Welcome to Baggage Claim Unpack Your Bags with Dr. Danita. I am absolutely thrilled tonight. I'm excited about this week's episode. This is actually our last week. This is our last week. We are in episode number 14, and it has absolutely been amazing. This topic has been so revelatory. I just the study portion that I have engaged in, the research, and just all of the information that has been provided by our guests. I just think it has been life changing for those who have been watching. And if you think it has been life changing for you and you've gotten information that will really help you as you move forward as an African American, um, or even as a white person, just gaining education that will help you better understand or be more compassionate or be an anti-racist, to be an ally. Just let us know on. I'm holding my phone in my hand, but let us know, like and share. Um, we want everyone to have the opportunity to partake in and get this information. And so tonight we have two guests who will assist us with the live on this evening. And we're going to welcome back Robin Simmons, and we're welcoming Julian Smith. Both Robin Simmons and Julian Smith are nurses. They are in the healthcare profession, and we just want to give you time to introduce yourself, and then we'll move forward with tonight's topic. So let's start with Robin.
Okay, good evening, everyone. I'm Robin. I'm a registered nurse. I've been a nurse for over 28 years. Over 20 of those years, I worked in community health in a federally qualified health center. And currently, I work at a multi-specialty um, physician-run organization where I oversee primary care services. And I also am a founder of Your Beloved Purpose Holistic Health and Wellness, where I teach women how to live a holistic lifestyle, make healthy choices, which ultimately they will make these choices for themselves and their families and then impact the community. So I have my hand in a lot of different things, but I really enjoy being a nurse.
Awesome, awesome. Thank you so much. And Julian?
How you doing? I'm Julian Smith. I'm from Philly. I currently live in Baltimore, Maryland. I work at Johns Hopkins Hospital. I've been a registered nurse for about 4 years now. I'm a COVID ICU nurse currently. Previously, I was a IMC nurse, intermediate care nurse. Um, I've just been trying to dabble in nursing, just try to see what what everything is there to offer. So I'm just kind of got my eyes on the prize right now. I don't know if I can make 28 years, but my goal is to be in it for the long haul.
All right, all right. Well, welcome both of you. As we think about the episodes and just to recap a little bit, when we think about racism bleeds over into every sector, really, of the African American life. And so we think about how it bleeds in education, it bleeds in law enforcement, it bleeds in the housing, it bleeds in communities, it bleeds into the access of healthy food, to healthy food. It bleeds into journalism, into entertainment, into church. And tonight we're talking about how racism bleeds into healthcare. And so tonight's topic is racial trauma in healthcare. And so in our first live, we defined trauma. We defined it as when our psychological, our mind no longer has the ability, when there's been either one major event or a host of events that cause so much stress that we're no longer able to cope, and our mind cannot sustain that emotional trauma any longer. And so when you think about all of these areas in which racism has bled into our into the African American life, I would say definitely collective. As a collective, we as a people have been traumatized. Wouldn't you agree? Yeah.
Definitely. Definitely.
So wanted to end with this topic in light of all that is going on, the crisis, the healthcare crisis that we are experiencing in our nation, in our world, with COVID-19 and with the pandemic. Um, we wanted to end with this topic, and so when we COVID-19, uh, initially everybody was like, oh well, we want to even plan the one thing, that is touching everybody. And then very quickly, we found out that the death, the those that were getting and the deaths were rising in our community, and 3.5 more times than in the white community. And so the statistics have been rising, the deaths have been rising, and with with the thought of that, and thinking about how it's been centuries of racism and so many stories that we have about racism in healthcare profession. We can definitely say that the racial health divide is undeniable. It's less likely that I would say that I read that it's less likely that we would be admitted for emergency care. That we have the highest rates for cancer and cancer deaths. There's twice as many African Americans that develop diabetes, and the list just goes on and on. Higher infant mortality rates, more likely to have chronic illness, more likely to have a diagnosis of severe mental health illness. And so when we think about this, this is clearly not a thing of the past. It's what we're dealing with now. And so when you think about that, let's talk about the ways in which you have experienced in the profession racism. What has been your experience with racism in the profession? Any one of you can jump in and start.
Julian, you can go.
All right. Racism in the profession specifically, it is a scale, and in my opinion, it will be as subtle as uh, saying things like patient is a frequent flyer. I think nurses sometimes we just say people are frequent flyers, or we kind of tell these like tail marker signs that they come all the time, and so it can be as slow as that, or it can be as high on the scale as someone, because we miss the mark so bad that someone loses their life. In my personal experience, you witnessed them all. I had a lady. It's not funny at all, but I had a lady one time. She was, older Black woman. Um, she was in pain because she was having an active heart attack, but her personality was a bit sharp. It wasn't welcoming and comforting. She wasn't the nicest patient, but she wasn't disrespectful either. She was in pain, understandably upset. As I was leaving to go home, I heard a nurse give him a report and saying, like, yeah, she's having 10 out of 10 chest pain. Didn't think anything of it because she wasn't my patient. When I came back that night, that was my patient. So I come in about 7 o'clock, get a report. Oh, she said 10 out of 10 chest pain. She's being Tylenol. So I walk in the room. First thing I asked the patient, how's your pain? 10 out of 10. I said, well, is that okay? She said, no, but they've been giving me Tylenol. So I called a doctor and like, hey, she's saying she has 10 out of 10 chest pain, telltale sign of like a heart attack. Even if it's not a heart attack, we should be a bit concerned. But I knew from the night before that she's been having that all night, so now this is 24 hours she's been having chest pain. I tell the doctor, like, can you at least give her something else? He says no. She's like that. She just mean, essentially, is how he responded to me. as I go on to now, we're escalating. I'm frustrated now because I'm saying, hey, this could be my grandmother, my mother, anybody, and I'm just like, but she's having textbook signs of a heart attack. And as the night went on, all her symptoms just progressed, and we wouldn't make any interventions because I'm a nurse. I can't make it on my own. But he wouldn't make any interventions until you see it at the final stage when she's saying I can't breathe, when she's saying my blood pressure or my chest is hurting so bad, it's elephant sitting on me. Like you had to say everything that was textbook for them to say, oh, now we see, and then as it, of course, the trajectory wasn't as what we expected or wanted to happen. But at the same time, if it was a different patient, they're allowed to advocate for themselves. They're allowed to say like, hey, I don't feel well. And it's taken face value, when it's African American people. It's not always, but more likely than not, you're being rude or you're being frustrated or you're being upset. It's not like she's being angry because her needs are not being met. But other people, when their needs are not being met, they're more inconvenienced. They're not angry, they're not aggressive, they are inconvenienced and they're speaking their minds and articulating for themselves and advocating for themselves. So for me, racism in healthcare is subtle, and it's hard on nurses because you have to navigate both. The patient might not think you know what you're doing, and it could be black or white, or any other color. I come in here, people think I'm 15, and they treat me like a child. But I've been working as a nurse for 4 years, and it goes on both sides. The patients sometimes don't respect you, given their nationalities and what they know, and sometimes the physicians and so the point is, being a nurse, you're in the middle. You're like a liaison. So I think you see it firsthand because you are the in between. So hopefully it makes sense.
Yeah, thank you, thank you. Yeah, statistics actually say that 1 in 5. It was a poll done by the Kaiser family. It said 1 in 5 Black adults say that they were treated unfairly because of their race in the past year. And so that speaks to what you are sharing, Julian. Robin?
Um, well, I've definitely had, moments throughout my career where, I had to deal with patients, just being a Black nurse. And especially when I did some time teaching students in the long-term care facility. And, those patients are much older and dealing with dementia and other issues, but they that embedded racism is there, and it just comes out from time to time where they call you out of your name or they don't want you to touch them. Just all kinds of, it's just there, and you have to figure out a way to deal with it. You have to figure out a way to do your job. You have to, and I look at every patient as if they were a loved one of mine, and how would I want someone to treat my mother, my husband, or whomever. So that's the way I approach it. But they feel that they have the they're entitled or the privilege to just treat us any kind of way just because of the color of our skin. But we still have a job to do, and we have to swallow it often, which is unfortunate, but that's just the nature of our career, of our profession, and that's what we have to do. I have a different perspective as a Black woman in leadership in a healthcare facility, where I've had to approach things in a different way and look at things in a different way, because there are physicians or patients or families that don't feel that I should be the one to take care of a situation because I'm a Black woman. So that's a whole other set of issues that I have to deal with on a daily basis.
Yeah, yeah. What about this? That's one of the questions that we were going to a little later on, but we can hit now since both of you have made reference to it. How do you handle that? You've taken, well, I don't know if it's an oath, but you have committed, I should say, committed to taking care of all patients. And so when they don't want you to touch them, or being rude to you, and will have the responsibility to care for them, like how does that play out? Do they ever get actually assigned to another nurse, or does it get that serious where they absolutely will not allow you to take care of them?
I can go if you want. For me specifically, I went to Morgan State University for nursing. My favorite HBCU. So if you're listening, Morgan State. But one thing that one of my professors always taught us was leave your personal biases at the door before you walk into the unit. And for whatever reason, that's something that stuck with me. So I could be pissed, and then I come across the unit. I will, for the most part, the patients. I will leave it where patients don't get to experience that, because nursing is hard and it is very stressful. But when I walk into the room, for at least up until this point, I haven't never taken my frustration on the patient. Never. And I make that a common practice. And then the other thing is you kind of treat people like family, which can be a hit or miss, because my family knows that I love to give tough love. So some patients don't, take well to tough love, but some people do, But I think just being sensitive to the situation and what your patient needs or doesn't need, and then kind of figuring out how to navigate. Because when I was a very new nurse, I got a patient that was I don't even know what he was, but when I came to the unit and got report, the doctors came and apologized to me. I thought it was so weird. They were like, "I'm so sorry it had to be you. I'm so sorry." I was like, okay. So I go in the room, I see the patient. He has white power, a big giant, like all of these tattoos of like World War II and like swastikas everywhere. And I just looked at him and he looked at me and I said, "Look, we're going to have a good night tonight." And he was like, "No, it's not what it is." And, he apologized initially, but I just said, "Look, we're just going to have a good night. I'm here to be your nurse." And honestly, we had an amazing night, But if I would have went in there and kind of take on people's expectations and fears and thought process, I would have came in there and tell them, "I'm Black. You want to listen to me? I'm your nurse. I'm a professional." But I didn't. I just came in there and say, "Look, hey, I'm your nurse." I was very soft about it. I wasn't like aggressive. I say, "I'm your nurse. We'll be together tonight." And we had a good night. Now, other people, they don't want to hear that. But for me, I try to just go in there with an open mind. I think that helps me more than not. Just going in with an open mind. And when you do that, most people, even if they do have reservations, they'll say things like, "You're different than everyone else," or "I didn't think they were like that." Just like he kind of swallow a little bit, but at the same time, you know that you made an example for somebody. Like I had a older lady, she's like 90 or something, and she said that little color boy was nice. I was like, I haven't been a color boy before, but the recognition of her saying that I treated her well, that I gave her quality care, you gotta kind of roll with the punches. So that's what helped me.
Yeah, I would agree with Julian. It's the same. It's the approach, and I just can't really think about how they're treating me or how they might be feeling at the moment. I have a job to do, and I know my approach is always nurturing, always caring, and always thinking about hopefully a good outcome. And that's what I have to deliver. And usually, just as Julian said, by the time the shift is over or the day is over, they're thinking about things differently because you didn't come in there with your boxing gloves on or with your defenses up. You came in there to do a job and you treated them with dignity and respect. And it just, oftentimes for me, it just turns out in a positive way.
Yeah, that's good. I know that it's the professional thing to do, to obviously treat people with dignity and respect. But do you feel like I'm Black and I have to overdo it? I have to go beyond what a nurse that doesn't look like me would have to do.
Yes and no. So my school also taught me that you have to be twice as good. So there wasn't really an option, and it wasn't like because other people don't have to. It's just because of who you are, what you stand for. You just have to be twice as good. So I don't really get the option per se to worry about what other people are doing because I have to be twice as good. Like that's just how they taught us, and their focus was bedside manner. So amongst other things, but bedside manner stuck with me personally. So bedside manner was something that they drilled into us. You have to be an amazing bedside nurse. Like that is something that they just wanted you to do, and it stuck with me. In addition to that, I think going above and beyond, I think it's also my person, because I chose to be a nurse. It didn't just kind of fall out of the sky. I chose to be a nurse because I wanted to do something where I can help mind, body, and soul. So I think also the profession seems like healthcare is coming away from that, but we are there to help nurture and treat mind, body, and soul, not just the clinical issues. So I think sometimes I have to remind people, I'm a child of the king, so let me just set you straight real quick, and you have to let people know, like, I'm not accepting that, and it's because of who I am. And sometimes you have to pray with somebody and let them know where you stand, and people respond differently when they know that you're multifaceted, and not just one-stop shop. They know, if Julian can pray with me, he can give me tough love, he can fight with me, he can articulate and advocate for me. Dang, he's a full package. But some people, they don't have to do that, but that's just who I am outside of nursing. But it helps that I can do that at work or my profession. And I think patients, oftentimes, they appreciate it at the end of the day. So it helps me.
What about you, Robin?
Perspective of what I do today, because it's just fresher. As an administrator, I oftentimes run into situations where, if something happens and is escalated, I have to come and fix it, or meet with the staff member, or meet with the patient, meet with the family. And oftentimes when they see me, they're not expecting me to be that person to come and fix this issue. And I make a point of coming to work dressed, my colleagues don't, presenting myself in a certain manner, speaking in a certain manner, because I know I won't be able to get away with some of the things that my colleagues do. And when I go to present myself to these patients, families, or my staff, I have to take it up 10 notches. Otherwise, the respect level won't be there. So it's unfortunate, but that's just who we have to be when we enter into, these scenarios or these arenas. It just has to be different, a different approach, a different level of care, a different level of education, to be respected and for people to take you seriously. And I don't have a problem with explaining to them who I am, why I'm here, and what I can do for you, and what I won't tolerate, because I've had people say things to me or ask me, well, who are you and what are you supposed to do? And then I have to help them understand who I am and what I'm going to be doing for them in this moment. So, and I don't see that in my colleagues, having to do that, having to explain themselves and having to present themselves in a manner where, you have to command that respect. So I don't think that, that's always fair, but that's just who we are and the nature of the game. And I have to just bring it every time I come to work. So, I'm used to it now, but it's unfortunate.
Yeah, I have to agree with you. As a Black business owner, I have experienced the same. I've thought, just as Julian said, that harder, we work smarter, we have to put forth, that extra effort to, in our presentation. And I was having this conversation with my son. One of our lives talked about code switching and our language that we use when we go into professional settings, and I began to think about it. As a mental health professional, we deal with people every day, all day, and we're communicating. And so I began to, think about how even I have internalized racism, and I've given several examples of how I've internalized racism. And I was having this conversation with my son, and I was thinking about how many times I have heard white professionals use poor language, putting prepositions at the end of sentences and dropping endings. But when I hear it from professionals that may work for me, or and they're people of color, it's like, oh my gosh, I need to correct that. I need for them to use proper grammar and proper English, and when other people get away with it and no one has anything to say about it. And so that's just it. I've gotten accustomed to it, but should we really have to get accustomed to it? And I have these this dialogue going on back and forth with people. Why do we always have to get accustomed to when everyone else doesn't? So going back to history, and we're going to move forward with our next question. So I'm thinking about a book that Harriet Washington, she wrote a book, Medical Apartheid: The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present. And so we all have heard, especially those who are in the medical field, it was part of our studies over and over again. Every class almost that we had, they talked about the Tuskegee experiment when we had our ethics classes, right? They talked about that, and that has been the most popular of the medical experiments that were done on Black people that was a real atrocity. But Harriet wrote about in her book about all of the others that took place that we never even knew about, all of the surgeries that were done on slave women as an experiment, not giving them anesthesia, saying that they had tough skin, and we as a people have the ability to handle pain more, and just all kinds of atrocities that have taken place. The Henrietta Lacks, she had cancer, and her cells were used for, unbeknownst to her, for cell research, and there were never any reparations, and she got no credit for that early on. Until recently, it became more popular. There were ongoing grave robbing of Black people to do studies. The list just goes on and on and on. And so when we think about that, obviously it causes a significant mistrust. There's a mistrust in mental health. It's been very difficult getting African Americans to seek out counseling. Then there's a mistrust in the health profession. So we have people who are in need of care, in need of health services, but they don't trust the healthcare profession. Let's talk about that. We're generations after those particular atrocities that took place, and we still have this mistrust that we're dealing with.
Well, it's going to take some time to undo all that has been done to our race and community. It's, it could be easy for me to say with mistrust that, there's a lot of information, a lot of research that has been done depending on a person's disease process to, kind of look into it for themselves. But everyone doesn't have the means or the education or the understanding to really dive deep to figure out, okay, is this doctor telling me to do the right thing for my illness? I would just encourage people to get a healthcare advocate, someone that they trust. You may not trust the information or the research yet, but if there's a person in your life or even a healthcare professional that that you can use as a healthcare advocate, and then come together and partner so that you can start breaking down information and gaining trust. Because when you know it for yourself, not that you're going to know on the level of a physician or a nurse, but have some type of understanding to go and question about my health, or you, doctor, you said X, Y, and Z, but the literature says this, that, or the other. Let's talk about it. And I think that's part of the problem is the respect is not there always in the exam room. The doctor might just give you whatever they think that, you need to have, but it's not a deep dive, and nor is it a plan of care that would be given to your white counterpart. So, sometimes a lot of times we have to be prepared for our visits. We have to have our questions written down because you get rushed out of the room a lot. So we have to do things on our part, unfortunately, so that it can be a meaningful conversation when we go in to see our physicians, and not just taking the first thing that they say, you need to have this test or that test, but, give me some time to think about it. And if you feel uncomfortable, let me get a second opinion. So I think we have to empower ourselves, educate ourselves, find trustworthy people in the community that look like us. So even a person like me should get more involved in community, as I was a few years ago, so that I can hold the hand of someone and go to the doctors with them. And then I think that they would feel better with being more compliant with their care. But it's a definite problem in our community.
Yeah. I think about, we say we should educate ourselves, but I think about our grandmothers and our grandfathers who, don't have that ability to really educate themselves,
Yeah.
holding their hand. And they really do depend on their children and grandchildren to help them make, the best decisions for their care, because don't trust the doctors. And even with this vaccine now, a lot of Black people just don't trust getting the vaccine for COVID, because a lot of people in general don't trust, but as a people, just like another thing is this going to be something that is not going to be good for us, or going to have all these major side effects for us.
I think what I would say is the mistrust is it was well earned. But I will say with our community, I think we at times need to hold healthcare accountable as a community. I think often we're upset and angered after the fact, which is totally justified. But I think, like how Ms. Robin was saying, putting forth the extra effort up front, before you get into the room, allows you to question a doctor, because there's already a hierarchy in healthcare. So if you come in there upset or angry, then it's defaulted to that's how you are, that's your personality. There's a nursing book that I have that says African American people don't like eye contact. That's in the nursing book. It was, I graduated in 2016, but in the nursing book, it said that was one of the signs of how to be appropriate with the culture, and so these kind of things are how people are taught. I happen to be African American, so I know that's not true, but someone else who's reading a book, they don't know. So I think holding ourselves accountable first, holding the healthcare accountable second, and then, like you said, being able to take a second opinion. I have a cousin who's not in healthcare at all. He gets the best care that I know. Like, he's not afraid to say, I'm going to fire my healthcare team and I'm going to find a new one. He's not afraid to say, this doesn't make sense to me. I'm not leaving until you explain it to me. And they treat him different. I'm a nurse and they still treat me like I have never heard of anything, and until I open my mouth and say that I'm a nurse. Then everybody's like, oh, I didn't know. I read your labs. I'll send it over. I'll read all the information. But if I just walk in there, they'll look at me and say, oh, he's a child. Send him on his way. Do the physical. Quiet. But when you say, oh, I'm a registered nurse, then there's a second thought. But I think, for African American people, we do have to do the extra steps. It's unfortunate. But once we continue to do it as a community, then they will have to come correct, because we're not playing, and I think, like, I work at Hopkins. That is where Henrietta Lacks, experienced all that stuff. But when I started there as a nursing student, there were many people that had no idea. They were like, you're not experimenting on me. I didn't know what that meant. They wouldn't explain. It was just like, maybe like older generation, but they would say it all the time. You're not experimenting on me. Until I start asking people, what does this mean? And then, of course, the Henrietta Lacks and all that stuff came. But I live in Baltimore, where Johns Hopkins was a part of, basically the healthcare apartheid, and we, as a healthcare individuals, we all continuously speak up, we continuously empowering. But I think too, African American, we have to require more. So with the vaccine, the reason why the vaccine was so scary, at least for me personally, is because they basically said a Black lady made it, so you should do it. There was no this much statistics in African Americans, this is the turnout, this is the efficacy, nothing. It was a Black doctor made it somehow, and so you should do it because she did it. You know, my brothers and sisters. I was like, that's not reasonable. You know, it's not, that's not appealing to me. I want you to treat me like everyone else. These many Black people had the vaccine. These many Black people had these side effects. This is how it looked in African Americans, and actually do a study. But that's not how they present it. And everybody's not going to read the 100,000 pages of literature. It's not realistic. But we should require them to talk to us with the same level of respect. Yeah. I happened to get the vaccine because I worked in COVID, and it made more sense for me. And I did read some of the research, you know, because I've been working in COVID a year at this point. But, you know, if I wasn't working in COVID, I would never get it, ever. You know, if I never seen people on events and dying and you know, holding loved ones' hands as they took their last breath, as I'm the last person that they see before they, you know, pass on. Of course I would never get it. But since I'm there, it makes more sense for me. And what I would say also is start trying to find people in your community that do look like you. So I went on Clubhouse, which is a new app, but there's they had a conversation for Black doctors to talk about the vaccine. It was like 40 Black doctors, and they all went down the line of saying why they think the vaccine is this or what their questions were. I was able to ask my questions. Even being a COVID ICU nurse, I still had reservations, and I was able to tap into a community of Black doctors and ask them, how do you feel about this? And they all said their different things, and it helped me because these people look like me. You know, these people know some of the struggles. These people understand where, coming from. And I went on, based off my research, the Black doctors, a few of my coworkers who are Black nurses as well, and I got the vaccine. At this point, I'm safe. Got both doses, didn't have any. I didn't have any reactions, but you know, I had to put the extra work because the fear is not going to go away if you don't do the work. So, just hold them accountable.
Yeah, I hear what you're saying. I think in several of the topics we talked about how as a people, we need to be more proactive, that we need to hold, you know, we need to hold people accountable. It goes back to those of us who are more privileged, because if you're in the inner city and you don't have education, you don't really feel empowered. You feel very inferior. You feel very like you just don't have what it takes, even if you did a little bit of research, to go in there and actually say to a doctor, like Robin, you said, you know, question a doctor. Or I know there have been times, and I am a professional, that I felt like, ooh, can I actually say to them that I'm going to get a second opinion? I would feel a little insecure about that because it's just something that I don't know much about. So how dare I question the doctor who is, you know, the professional in this? But, you know, when I think about it, to me, you know how you go to customer service and you get one opinion and then you're like, okay, let me call again. And you call again, you get somebody that says something totally different. Then you call a third time and you get even a third. So the same thing with healthcare. There are times where people have gotten 3 different opinions and you're like, okay, now what do I do? And so, you know, the mistrust is just really perpetuates, unfortunately, especially because we just really, you know, we really don't know. But I like that idea of having an advocate, of somebody that looks like you. Of course, we have to deal with our internalized racism, because there are Black people that would say they don't even want to see a Black professional because they don't trust that you have what it takes and that you have what the white professional has. And so it's just layers upon layers that, you know, that we're dealing with people. And so I was I was thinking, there's another question that we have here in reference to healthcare progressing. You know, in every industry, there's always progression and moving forward. And there's a lot of talk about using artificial intelligence. And we would think with progression and with forward movement that it would have a positive impact for everybody involved. And so the whole idea behind artificial intelligence is to make the care better for the people that are being served. Do you? I don't really know a lot about artificial intelligence and what the wave is or what the future is as it relates to healthcare. I don't know a lot about that, but is there going to be an impact or a different impact for our people in light of racism being very prevalent, very obvious in healthcare?
I did want to say with technology, I think the thought process behind the technology can impact the disparity in healthcare already. So, like, I think a study just came out. I know a study just came out about pulse ox, where you basically read your oxygen level on your finger, and it was basically saying that the pulse ox, given darker skin, it might not read as well as given lighter skin or paler skin, and so thus resulting in people who are African American getting different results on their um, treatments because their oxygen levels are lower. So for me, there's always a fear of how does the thing that is the gold standard come to be, and if we're not in the research trials or at the seat of the table, will we be represented? That's my fear. But specifically, I haven't seen anything overt with like artificial intelligence or more advanced technology that helps cripple, but it does make sense. And I think it's subtle. It's not like, we just do more people who are willing to do. And since we have fear, a lot of us don't participate, So it's just like perpetuating the cycle, like if I didn't get the vaccine, I couldn't tell someone else who looks like me, who's not a healthcare professional, who doesn't know, who doesn't have the education, who's not privileged, as I am at this moment, that you should go get the vaccine. How can I do that? The only way that I can do it at this point is because I've gotten it. I could lie, I guess, but I would rather not. So ideally, if you're not, and they're not paying to tell people to get the vaccine. So, is that someone has to take, the first step. And I think Black healthcare professionals, at this moment, we are taking the first steps. We are showing up. We are coming to work. We are working in these hard conditions to show African American people that we are here. We're not in the back of the hospital hiding away. We are at the front line. We're working hard every day. We're doing the things that many people don't want to do. They talk about online, but we are physically doing it. So I think what we have to do, like you said, in our communities, we'll have to start trusting the people that are actually doing it. The people that are actually taking the time to sacrifice and do the things that a lot of people don't want to do, which is okay. But take our struggles, take our experiences and our research and listen to it. It doesn't have to be, I say this so you do it, but just listen and hear, and then you make your own decision, And I think that is where technology and all those different things, if you're at the seat of the table, you can say, how many African Americans have been affected by this? How has this affected us? Because when I look at the research, a lot of people have Asian American, this percent, Pacific American, they have like Pacific Islander, they have the breakdown. And then, African Americans is always like a very slim number. So, we have to change the game, really.
Yeah.
Yeah, we need to be. That's what you said. We need to be at the table.
Yeah.
I'm sorry, Robin.
No, I was just going to comment on the artificial intelligence. I know my organization is looking into using that on different platforms, but I would say, we would have to challenge the data. There's a study about artificial intelligence being used for insurance companies to decide where they're going to place their resources, because the goal of the insurance company is to keep the cost of care down for the patient. And they look to an organization like mine and saying, what are you doing to make sure this patient stays out of the hospital, or you're giving this patient other resources to help them manage their comorbidities at home so that they can keep this cost of care down. So this artificial intelligence did a whole study on a population of people, and there was a percentage of Black people, and they looked at the cost of care. Now, a lot of Black people that do have insurance, they still don't utilize their insurance to the highest level. They might not even because of the trust factor and so many other things, and they might end up in the ED, once in a while to, for a diabetes episode or whatever, but they're not using all aspects of their insurance. So AI looked at the cost of care, and it kind of put them on par with someone who the cost of care wasn't, as high, but they had all of these other risk factors with chronic conditions. So when they looked at them and matched them up, they said, oh, these people don't need any resources because their cost of care is low. Instead of looking at risk and chronic conditions, they looked at cost. So therefore, this population of Black people, they didn't get the resources that they needed because the insurance company felt that they weren't spending a lot of money. They don't have these chronic conditions. And the focus was all in the wrong place. And once they did a deeper dive and saw that these Black people have, hypertension, diabetes, other cardiovascular illnesses, they had to flip that and redo it. So I think data can be manipulated, even if it is artificial intelligence. And as Julian said, we have to have a seat at the table. We have to be able to look at the data and really, because something like that would have jumped off the table at me and said, this is totally wrong, because I know this community, has these comorbidities. It's just prevalent in our community. So I think, it's definitely coming, but we definitely have to be at the table to look at it because data can still be manipulated.
Yeah. Are we from your knowledge of? Are we at the table?
It depends on the organization. Like at mine, I'm the only one. It's me, and I have to speak up often. When I see things that are not the way that they should be, or I see a community of people that are not being treated fairly. But I don't know that many of us are at the table. There's not a lot of us in administration in healthcare, especially not at the C-suite level.
Yeah.
Yeah.
And I think also the table is not 100% inside healthcare too, because sometimes depending on which type of community you have, your community, and you can pressure your state officials, your elected officials to request these different things for your community. And I know it's hard work, and I'm not saying it's easy, and I know it takes a little bit of, knowledge to do that stuff. But, I live in a community that's predominantly African American, they revitalize it. It steps away from Hopkins. But, since moving here and being a part of another disparity, I've learned that we have power in numbers. We have power when we speak to our elected officials, and our elected officials can apply pressure to the healthcare department, to different organizations that run and fund these places. They might not be able to get the company that does the research, but they can apply pressure to the place that funds it. So if I say, hey, I'm feeling like this is not, affecting me or benefiting me in the way that I feel like it should, I can write my city council person, I can write my governor, I can write the mayor. It might not, if I can't write, I can at least speak with them, and just start bringing awareness to where they apply pressure. And these kind of things, you hit it on the grand scheme, it's everywhere we apply pressure, not just the healthcare workers in the hospital who have to, Lord willing, spend their whole career to get to the top. But, the people can do it now, today. You can write the mayor and say, hey, I don't like how this hospital doesn't partner with my community. And if enough people write a letter or complain, eventually it'll be a conversation. Since my neighbors and I started complaining about our community, we start having town halls where they're telling us what's going on in our community. They start telling us what Hopkins and what they want to do with our community. They start asking the people who they never asked before, what do we think? And these are the kind of things you have to just, the squeaky wheel gets the oil. And if we sit there and be complacent and quiet, it's easier to bulldoze until they say, oh, this is a big deal years later. But we have issues now, that are affecting us today, that we can make noise about now. We don't have to wait till AI comes out and affects us all. We can start complaining about it now so they know that we're not going to stand by it later. And I just given a different look at it because it doesn't take a bachelor's degree in nursing to have a gripe and know something is wrong, and it doesn't take really rocket science to say, I don't like this. This is not right. A lot of us have cell phones and you can use that phone. You can talk about online, just start getting the awareness out there. You can use your social media as a platform to bring awareness to what our community faces. And if all of us do it, we all do the same thing, they make changes faster. So that's kind of how I think about it as well.
Yeah, I think as a people, I think we're getting there, but as a collective, we've had more, I don't know about lazy, but just not feeling empowered to make any change. So we just accept and continue to do what we've been doing and push life along. We also are still overcoming the post traumatic slave syndrome where master taught us to be crabs in a barrel and pulling each other down. And we spend so much time not supporting one another collectively, but, you know, in competition and all of those things keep us from moving forward in a productive way. But we have seen, obviously, we've seen change and things have gotten better. And so I agree that we really have to pull our resources together and see to it that we, get a seat at the table, not necessarily within the organization, but like Julian, like you said, with, outside, with our local officials. There's a question that was asked to you, Robin. What kind of response do you receive when you speak about the discrepancies that take place in your, in your workplace?
I've been fortunate enough in my organization to gain the respect of my colleagues and administration. So oftentimes, and they give me that feedback. I'm not, a big talker, but if there's something that needs to be said, I will speak up about it. And that's the response that I get a lot of times. You don't say a lot, but when you speak, it's very important, and we're listening. So I have been fortunate and blessed that, I do have the respect of the administration and my colleagues. So they are listening, and they will continue the conversation when I bring something to their attention, which is, something that is not even specifically healthcare, but it's just about this whole, climate that we're in, because the organization wasn't really looking at racism. They, all of the things that happened last summer, there was just nothing going on in our organization where it gave our staff and people that work there a platform to talk about it, to vent, to share. There was nothing. And two of my colleagues and I, we got together and we wrote an email to the president and the CEO, and we got a platform. We talked about it, and now we have a diversity, equity, and inclusion task force, and we are moving forward in that direction. So there is a level of respect there, and I'm grateful for it. So I do get the feedback, and I do have a platform to speak about things that I feel need to be looked at, and we need to have change.
That's awesome, Robin. Every week I talk about getting in your lane and staying focused and doing what you can do within that lane. And so you having that opportunity and having that voice, that's great, especially since you have shared that you don't work in more in the community, and you work in a predominantly white space. And so that's really good that you have that opportunity to to have that voice. I encourage you to to continue. So
Plan to.
so when we think about all that you as nurses and everyone else in the healthcare profession, what you experience day in and day out, especially with the pandemic. I know Julian, you're in emergency. You work in emergency, so I'm sure you probably see a lot more than Robin does in her position. But just knowing daily what the helpers are experiencing, the vicarious trauma we call it. You may not necessarily have the trauma hitting you specifically, but just watching it every single day and knowing what people are experiencing. Are you, as a collective in the healthcare field, do you get help? Do you get health services? Is there any kind of guidance or even a mandate that you have at that level?
Specifically, I'll say yes and no. So I know my unit has been the designated COVID unit for COVID at Johns Hopkins. So we've worked in COVID for an entire year without a break. I know Hopkins has put forth a lot of just resources, or well, at least my manager is, at the very least. She's tried to put forth a lot of resources. Like they have like different teams and people we can talk to, which is all voluntary. It's not, you don't have to do it, so it's not really a mandate. It's kind of like voluntary. So if you choose not to, there's no penalty or rule. But I know it's available. More specifically on the personal level, I started therapy previously, but it continued during COVID because I realized I work in a high stress environment. I deal with death and deal with like high stress all the time. And I just, decided that therapy would be, well, I'll try it out first, but therapy would be something that can combat the high stress and just help you take another perspective. So I started therapy, and then obviously therapy, they recommend like working out, doing things that we all know that we should do. Just put it into perspective for me as a nurse. So I think that is one thing. And then the reason why I would say no is because it's not required. I think as healthcare professionals, we do go through a lot, and I think it should be required that you do some kind of counseling or something, just so you can know where you stand. I don't know if it should be required that you pay for it. If it was free, it'd be nice. But I think also just knowing how to navigate your insurance, because if I pay for insurance every month, however much, I didn't know there's so many benefits and resources that are in my insurance. And I had a colleague tell me years ago, you should try acupuncture. I was like, I don't know that, I know what it was, but I don't know how it works. But I realized it was only $10 per visit because I pay every month or every week for insurance. I'm like, wow, there's all of these different, things that you can try, like acupuncture. They have massage therapy. All these things are in the health and wellness that are covered in many people's insurance. So just like learning those kind of things too, that kind of helped me sustain during the pandemic.
Yeah. In theory, we talk about in the profession, we talk about a seamless experience in health and wholeness and wellness, but in actuality it's very segregated field. The medical profession is the medical profession, the mental health profession is the mental health profession, nutritionists are nutritionists, holistic people are less holistic people, and it's very rare that we come together. But it would be absolutely amazing if we were able to really come together and create experiences for people where they could really live whole. But I just encourage everyone who is experiencing every single day these ongoing traumatic experiences and seeing what they're seeing, especially you, Julian, being in emergency care, that you even encourage those that you are working with to to seek professional help and get that mental health care. Robin, you want to jump in?
Sure. My organization has done a great job with jumping in with behavioral health. That's the department, resources for from the physicians all the way down to, maintenance, whoever needs it, they've offered it. We've had over the months of really deep COVID activities, twice a week, we would have, group sessions available. They offered one-on-one counseling. And now we're doing, mindful meditations in the morning, just whatever he could think of to help support. There would be one-on-one check-ins. So there was a lot of support. A lot of people didn't take advantage of it. And like you said, Dr. Danita, just encouraging our staff and colleagues to do it. I've had to do that over and over, physicians breaking down and staff members acting out because of it. So I was just really grateful that we had the resource available.
Yeah, I think that's the thing, that it's never a requirement. And so when it's left to people to select, and they don't see the value in it. And so having peers say, yeah, I've been through, I have experienced, getting these, and sharing your testimony, so to speak, it does help, especially if it's not be mandated. And that's in so many high stress professions, that it's not mandated for people to find ways to de-stress. And so, it just,
Mhm.
it's really sad. It's a sad a state that we find ourselves in these high stress professions. I know that I want to say to you all, I mentioned several lives ago that I was waiting to get into the department as a police chaplain, and I really wanted to be able to make a difference, getting my lane, my mental health lane, and make a difference in my town. And so I finished my training, and I'm excited about that. But as I was talking in the training, they were sharing that although that police officers, all law enforcement, could benefit from, not just could benefit, needs to be in a counseling room. Every single one of them needs. It's not mandatory. And so I'm just hoping that as I begin to create these relationships with just those who are in, my town, just, making where I can make the difference, that I'll create a relationship to the extent that they'll have that trust, and seek the services that we provide at Mending Hearts. And so I'm excited about that. And I just said that to say that everybody, even those who are on the live, you have your professions, have what you're good at, you have your passions, and we say this every single week. Find your lane. Julian and Robin, they have their lane in the healthcare profession, and they're driving. They're driving their lane and making a difference. And before we come to an end, I know we have been talking throughout this episode about different things that we could do to make a difference and to move forward. But I just want to, even if you reiterate a few of the things that you shared, or you want to add to what you have shared, and how we can move forward. How can we create change? The one thing we don't want to do, and the one thing we kind of find ourselves guilty of as a people, is just complaining, just talking about, not that the things that we talk about aren't factual, but we got to do something different. We can't just keep rehearsing and nursing and regurgitating the issues and the things that we're going through without a plan, and
Right.
with a decision that we're going to be part of the plan and part of change. And so let's just talk about where we go from here. How can we make a difference, even if you reiterate some of the things that you shared earlier.
Go ahead, Julian.
I feel like it was burning, but I think specifically for everyone on the live and dealing with their personal health, recognizing that healthcare has taken steps to change to be a business, and so not feeling guilty to treat it as such. If you come in to a phone store and they're not offering you the service that you need, you would leave and go somewhere else. And you wouldn't feel bad. You're not going to say, oh, I feel bad that I'm switching services. I feel bad that I'm getting better service or better customer service somewhere else. You do it because it's necessary. Because whatever you're trying to do depends on it. And I think just taking that ownership back in healthcare and reminding people, at this moment, I need you, but you also need me, and what, at least at my hospital, what they try to say is that patients are in the driver's seat and we are partnering with patients. If you are in the driver's seat, that means this train or this car or whatever you want to call it goes wherever your direction is. If you have a different direction or different feel, you have every right to turn the direction. Everyone else is a backseat driver. So I think specifically in healthcare, just, reminding patients and reminding people that it is your life on the line. You are responsible first for your life. Yes, everyone has taken the school and the education and the knowledge to, give it to you. But at the end of the day, if you don't take the recommendations of the doctor, that is your decision. It's on you, So I try to remind my patients that often, you are in the driver's seat. This can't work at all without you. So I think being present and responsible for your life helps a lot of people not feel guilty. Because if it's like, dang, I don't really agree with this doctor says, but I take the fall for it, you might think a little different, Because if you think of it like, oh, this doctor's telling me what to do, I'm just going to do it. But if it doesn't sit right with you, you're the one who's going to be stuck. You're the one who's going to have the end result. And I think many people more than not realize it when it's too late. And you can realize it in the beginning stages and you have time to ask questions, then you're not in a bind. But oftentimes we wait until we already have the diagnosis. We wait until we already are at the end stage to have all these, aha moments. But we can do it earlier. You don't have to wait until the end. So I think just being inquisitive, asking questions, ask it until you understand, and if they can't break it down to you, ask them to get someone else. Just like it's totally okay to have your needs met, when it's necessary for you. And then the other thing too is just reaching out to African American healthcare professionals or whoever you feel comfortable with. It doesn't have to be African American, but whoever you feel comfortable with, asking them to try to break it down, joining things online like Instagram, following certain nurses and doctors and people you can ask, because we all have phones at this point, or many people have phones. You can use your phone as a tool. If you have Clubhouse for iPhones, you can join the Black doctors and ask your questions and say, hey, I don't understand this. Can someone help me understand this? And you might be able to connect with somebody. Just being, strategic about how you go about your healthcare. You don't have to tell anyone, but you can just kind of say like, hey, I have this question and I would like to, if anybody can give me some insight on this, and say it's with me, but just being creative and not relying on a broken system to treat you whole. So
that's good right there.
Mm-hmm.
System to treat you whole. And you also said we have the right to have our needs be met. I like that, Julian. Robin, what can you share?
Sure. I think we should keep this conversation going in the communities. Racism is alive, and unfortunately, we're still dealing with this. And those that have a platform should use their platform to speak up. We should partner with our local barbershops and beauty salons and churches to get the word out for preventive care, all the things that our community should be looking into, should be taken seriously, that their healthcare providers and healthcare professionals should be telling them already. But because oftentimes people in our community are not even looked at as human beings, we're not given this information and they're not being treated as such. So where we can promote advocacy for people like me who know better, then we should do that. We should definitely use our voices and our platform to make sure that our people in our community are getting getting the healthcare that they need and that they deserve. I think, and the holistic part of it, because oftentimes when they go to see the doctor might just be treating that disease process, but not looking at them as a whole individual. Why aren't you taking your medication? How come your levels are still going up? And not really looking at, do you have the right nutrition at home? How is your housing? All the social determinants of health that impact somebody's condition it's not always looked at, it's not always taken into consideration. So I think as a community, we really need to partner because they trust us. They will trust someone who looks like them. And we have to do a better job, those of us in these positions, to get the word out and to partner with people in the community and advocate for them and keep this conversation going.
Absolutely. Thank you so much for all that you shared on tonight. It has been absolutely valuable. I've been looking at, there's so many comments that have been made that I can't keep up. And we're going to have a live, we're going to pop up and just have a live where we pick out some of these questions and comments from all 14 weeks and just talk about that, because some people have made some really valuable comments and have asked some questions that need to be highlighted. But we just thank you so much, Julian. We thank you, Robin, for coming on tonight and for sharing your expertise and the education that you have that has been very valuable on tonight for our listeners, our viewers. And if you came on tonight, the one thing that you can do, when I tell you, we always end our sessions with sitting and thinking, reflecting about the information that we receive, reflecting about how it is hitting us depending on the topic. Each topic may hit someone in a different way and may touch you in a different way. But at the end of the day, we want you to say, like, I don't want to just sit in how I'm feeling. I want to be able to move forward. I want to be able to be different. I want to be able to make a difference. And so, again, we ask, wherever you are in your profession, in your life, and just get in a lane and stay in that lane and move forward. The first thing that you can do to create a difference is to like and share these lives, because they're going to make a difference for the people who are viewing them. And so if you haven't done so already, I see that there are some people that are regular sharers, and it tells me that you have shared. And so I'm looking at this list of people here and then looking at the names, and I'm waiting for it to pop up that you are a sharer, because that will tell me that this has been important enough for you to share with other people so that they can get this education and that change can be created. And so I'm just excited. I'm excited about us as a people moving forward in whatever way we move forward. I highlight Black agencies and Black business. And look at this shirt tonight. It has nothing to do with the topic, but I want to just highlight that a young Black entrepreneur gave me this shirt. Well, I purchased it. Gave me this shirt, and I want to give a shout out to Jalen Prillo, and he is the proud owner of Cradleware. And so I just wanted to highlight this shirt on tonight. I'm proud to be American with all of the have experienced that could put us in positions of saying, feeling less than. I'm proud to be who I am. And if you are proud, you let us know on this live that you are proud to be an African American. And we're completing our 14 weeks of this particular episode of trauma as it relates to African Americans and what we have experienced. And again, I thank you so much. We are coming to a break, and we may pop in once or twice again just to share or to reiterate some of the topics. But we're going to come back in April, and we're going to go into a relationship series, relationships across the board, work relationships, sibling relationships, parent relationships, intimate relations, just relationships across the board. And so I'm looking forward to that. Definitely let everyone know if you've been positively impacted by this 14 weeks. I can promise you that that series is going to help you in so many ways. And so definitely join us again. And also go to my YouTube channel and subscribe. And visit the page periodically throughout this month. We've been posting different information about Black history, those who are in the mental health field. And so we definitely want you to continue to be engaged with the Dr. Danita page. And don't forget to come back to this baggage claim series and have an opportunity to unpack your bags with Dr. Danita. I can also be found on Instagram and on all social media platforms, and I'm trying to use my social media platforms to progress our people, to progress mental health, and to just be in my lane. And so again, thank you so much, Robin. Thank you, Julian. We may have you back on again.
Thank you.
You've been
Thank you.
a valuable asset to our show this. So we want you to have a good night and continue to do what you do. Our prayers are with you. And yeah, thank you.